Imagine a medical mystery, right? But one that isn't really a mystery at all. It's actually a profound and entirely preventable tragedy playing out in animal health. It's the story of two compounds, seem fine on their own, but you put them together, and suddenly you've got a devastating silent killer. Today in the deep dive, we're plunging into something very specific, a severe toxicosis in swine. And it's caused by this accidental, often catastrophic interaction between the antibiotic tiamulin and these compounds called ionophores. So our mission here is to really unpack how this synergistic toxicosis, as they call it, actually happens, at a biochemical level. We want to look at the devastating impact it has and critically why it's often described as an entirely preventable management disease. It's a perfect example, really, of how digging into these complex interactions, even down at the microscopic level, can give you crucial insights and genuinely life-saving prevention strategies, whether you're a livestock manager, a vet, or, just curious.
Exactly. And for our discussion today, we've drawn heavily on two really comprehensive reports. One's called Tiamulin-Ionophore Toxicity in Swine, and the other is Tiamulin-Ionophore Toxicity in Swine, Prevention and Mechanisms. These sources really lay out the pharmacological mechanisms very clearly, the clinical signs you'd actually see, and crucially, the absolute importance of prevention out in the field.
Okay, so where do we even start with this? It sounds complicated. What are the pieces we need to understand first?
Well, yeah, it has layers, but basically our story involves two main characters, Tiamulin and ionophores. Let's tackle Tiamulin first. This is an antibiotic, belongs to a class called pleuromutilins, and it's used a lot in swine medicine for very good reason, actually. It's really effective against some major bacterial troublemakers like Mycoplasma hypopneumonia that causes pneumonia, Actinobacillus pleuropneumonia, another nasty respiratory bug, and also Brachyspira infections, things like swine dysentery. It's a real workhorse drug.
Right, so a vital tool, definitely something producers rely on. But how does it actually, work? How does it stop these bacteria?
Good question. It works in a pretty clever way, actually. Think of a bacterial cell like a factory, okay? Ribosomes are the machines building essential proteins. Tiamulin basically jams a critical gear in that protein factory. Specifically, it binds to a particular spot on the bacterial ribosome, the 23S RNA component of the 50S subunit, if you want the technical bit, and that stops the polypeptide chain from getting longer. So essentially, no new proteins get built, which means the bacteria can't grow or replicate.
Okay, stops the factory cold. Makes sense. But what's the kicker? What part of its pharmacology turns it from helpful medicine into potentially part of a big problem?
This is the fascinating part, and absolutely critical to understanding the toxicity. It's all about how the pig's body handles tiamulin. It gets broken down, metabolized, mainly in the liver, by a group of enzymes we call the cytochrome P450 system, or just CYP450. And here's the absolute linchpin. Tiamulin is a potent inhibitor of one specific part of that system, the CYP3A subfamily of enzymes. This isn't just, a side effect. It's the biological trigger, the thing that sets the stage for disaster when the other player comes along. This one action is really the heart of the whole problem.
Potent inhibitor. Okay, that sounds significant. So let's bring in that second player you mentioned, polyether ionophores. What exactly are these? Where do they usually show up?
Right, ionophores. These are compounds made by Streptomyces bacteria, and they have different uses in livestock. You often find them used as anticoccidials and poultry feed, basically, to prevent gut parasites. And they're also used as growth promotants in cattle, helping with rumen fermentation. You might recognize feed names with things like monensin, salinomycin, narasin, matramycin, lacillacid. Those are all common ionophores.
Okay, different uses. How do they work then? What's their mechanism?
Their action is all about disrupting things at the cell membrane level. Ionophores grab onto cations like sodium, potassium, hydrogen ions, and form these lipid-soluble complexes. This allows the ions to basically leak across cell membranes, including mitochondrial membranes, which messes up the essential electrochemical gradients that delicate ion balance the cell needs. This disruption leads to cell dysfunction and eventually death, especially in protozoa. That's why they work against parasites like coccidia.
So on their own, they're useful tools too, but
Yeah.
connecting back to what you said about tiamulin and those CYP3A enzymes, do ionophores use that same system?
Bingo! They absolutely do. Just like tiamulin, ionophores are also primarily metabolized by that exact same hepatic CYP450 enzyme system, specifically the CYP3A subfamily. So you see the conflict, right? They're both trying to use the same limited pathway for breakdown. And this brings up a really crucial point about ionophores. They have a notoriously narrow margin of safety. Getting the dose even slightly wrong, like just 2 or 3 times the recommended level, can cause severe toxicity all by itself.
Wow, okay. So if the safety window for ionophores is already tiny, and tiamulin basically slams the brakes on the detox system that clears them,
Yeah.
are we saying even trace amounts of ionophore contamination could become lethal, not just like a major dosing error?
Precisely. That's exactly it. And this is where it gets really, really concerning. The problem isn't usually a straightforward overdose of tiamulin or even the ionophore taken in isolation. It's what the sources call a synergistic toxicosis, precipitated by a profound metabolic blockade. It's the combination that's deadly. Biochemically, it's a shutdown. Tiamulin acts as what's called a mechanism-based inhibitor. Some even call it a suicide inhibitor of those CYP3A enzymes. What that means is, as the enzyme tries to break down tiamulin, a reactive bit of the tiamulin molecule actually forms a permanent covalent bond with the enzyme itself. It irreversibly inactivates it.
Whoa, so it's not just blocking it temporarily, it actually breaks the enzyme. The liver's cleanup crew gets taken out.
It's exactly right. The enzyme basically self-destructs while trying to do its job on tiamulin. So the liver literally has to synthesize brand new enzyme molecules from scratch to get that metabolic capacity back. And that takes days. Now think about the consequences, the pharmacokinetics. When a pig that's been treated with tiamulin ingests ionophores, even small amounts, the liver's main detoxification route for those ionophores is essentially offline. It's shut down. This causes two huge problems. First, increased bioavailability, much more of the ingested ionophore gets absorbed into the bloodstream than normally would. And second, a dramatically prolonged elimination half-life. The body just can't clear it out effectively.
So it just builds up faster and faster.
Right. Rapid progressive accumulation of the ionophore in the blood and critically in target tissues like muscle. It quickly shoots past that very narrow toxic threshold we talked about.
And this is so potent that even what you'd normally consider subtoxic levels of ionophore contamination, like maybe just 5 or 10 parts per million of monensin, maybe left over in a feed line, even that can become lethal.
Absolutely lethal. It completely redefines what significant contamination means in this context.
Yeah.
We're talking levels you might otherwise dismiss becoming incredibly dangerous very quickly.
Okay, we've got the biochemical train wreck figured out. But what does this actually look like for the pigs? For the producer watching their animals? What are the real-world consequences they'd see?
Right, the clinical picture. This buildup leads to a severe condition, primarily hitting the muscles. It's called myonecrosis, muscle death, essentially. If we talk pathophysiology, what's happening inside those muscle cells? It's pretty devastating. The ionophores cause this uncontrolled flood of calcium into the muscle cells from outside. This completely overwhelms the mitochondria, the cell's power plants, causing ATP production to just collapse. It also triggers these destructive enzymes, calpains and phospholipases, which start breaking down the cell from the inside. All this leads to the muscle fibers getting stuck in contraction and then ultimately cell death. Necrosis. Skeletal muscle and heart muscle are especially vulnerable.
Oh, man. And the signs must be awful to see. When do they typically start showing up? Is it quick?
It is quick, usually acute onset, within, say, 24 to 72 hours of exposure. You'll first see things like sudden anorexia, they just stop eating,
Yeah.
profound lethargy, really depressed. Then, as it gets worse, you see these dramatic neuromuscular signs, muscle weakness, tremors, particularly in the back legs, the hindquarters. Their walk becomes stiff, stilted. They lose coordination. That's ataxia. This can progress pretty rapidly to paresis, which is partial paralysis, and then they go down. They become recumbent. Often you see that characteristic dog-sitting posture just before they collapse completely.
Dog sitting, like that they can't hold their back end up?
Exactly. And you'll also notice breathing problems. Respiratory distress, things like dyspnea that's labored, difficult, often open-mouth breathing. Or thumping, where you see their abdomen making these big excursions as they struggle to breathe. Their voice might even change, sound different, because the diaphragm and the intercostal muscles used for breathing are affected too. In the final stages, it's complete flaccid paralysis, coma, and then death. Usually from respiratory failure because the breathing muscles give out, or sometimes acute congestive heart failure because the heart muscle is damaged.
That sounds incredibly rapid and severe. Is there anything else, any other telltale signs?
Yes, one other key sign you might spot is dark urine, almost tea-colored or cola-colored. That's due to myoglobinuria. Basically, as the muscle cells break down, they release their contents, including the protein myoglobin, into the bloodstream. The kidneys try to filter it out, and it discolors the urine. It's a visual sign that there's significant muscle damage happening.
And I suppose the post-mortem findings would confirm all this muscle damage.
Definitely. At necropsy, the findings really reflect this extensive myonecrosis. You typically see skeletal muscles, especially the hind legs and the loin area, looking pale, swollen, edematous, sometimes described as having a cooked appearance. The heart often looks flaccid, kind of baggy and dilated, and you might see pale streaks within the heart muscle itself. And the kidneys might also look dark, again, because of that myoglobin being filtered through them.
Okay, so given how fast this moves and how bad it is, how do vets actually confirm it? What's the diagnostic process? You need to be sure, right?
Absolutely. Diagnosis is really about putting pieces together. You integrate the history, the clinical signs we just talked about, and then key lab and pathology findings. History is number one. Was there concurrent or even recent Tiamulin-Ionophore exposure? That's the first question. Then the clinical signs, does the picture fit with that characteristic progressive muscle damage, the myopathy?
Okay, history and signs. What about lab tests?
For serum biochemistry, you look for muscle enzymes. Creatine kinase, ZK, will be markedly elevated, I mean sky high, often over 10,000 units per liter if the damage is acute. Aspartate aminotransferase, AST, will be up too. At necropsy, the gross pathology, what you see with the naked eye, is that bilaterally symmetrical pale or necrotic muscle, both skeletal and cardiac. But the real gold standard for confirmation, and a key way to differentiate it from other things, is histopathology. Looking at the tissue under a microscope, what you see there is segmental, multifocal, monophasic hyaline degeneration and necrosis of the muscle fibers.
Okay, you said monophasic. What does that mean here and why is it such an important clue?
Good question. Monophasic is really crucial. It means all the damaged muscle fibers look like they're in the same stage of breakdown. Think of it like looking at a battlefield right after the battle. All the damage looks fresh, simultaneous. It points to a single acute toxic event hitting all those cells at roughly the same time. If it were polyphasic, you'd see fibers in different stages, some just starting to degenerate, some actively inflamed, maybe some trying to regenerate. That suggests an ongoing or chronic problem, not one big hit.
Gotcha. So monophasic points to that single acute toxic insult from the ionophore buildup.
Exactly. And finally, you can do analysis on the feed itself or on liver or muscle tissue from the affected pigs. Using methods like HPLC, you can confirm the presence and even the concentration of the specific ionophore and maybe tiamulin residues.
That makes sense. But some of those signs, like muscle weakness or going down,
Well,
other things could cause that, right? How do you make sure it isn't something else?
you're absolutely right. Differentiation is key. Several things might look superficially similar. For instance, there's nutritional myopathy. That's muscle damage caused by vitamin E or selenium deficiency. It can also cause weakness, even sudden death. But typically that's more of a chronic issue. And crucially, the muscle lesions on histopathology are polyphasic, showing different stages of damage and repair, not the single-stage monophasic picture of ionophore toxicity.
Okay, so the histopattern is different. What else?
Salt poisoning or water deprivation. That can cause acute neurological signs. Pigs can go down, maybe even show that dog-sitting posture sometimes. But with salt poisoning, the primary signs tend to be more central nervous system related, things like head pressing, aimless wandering, maybe seizures. And post-mortem, you find very specific changes in the brain, eosinophilic meningoencephalitis, and really high sodium levels in the blood, things you don't see with this toxicity.
Right, brain signs versus muscle signs primarily.
Exactly. And then, of course, you have infectious diseases, things like strepsus meningitis or edema disease or various viral encephalitides. These usually present differently, maybe with fever, specific types of neurological signs, or gut issues like edema disease. You'd confirm those with bacterial cultures or virology tests. And importantly, they don't cause that widespread characteristic muscle necrosis that's the hallmark of Tiamulin-Ionophore toxicity.
Okay, so for a producer or a vet facing this, once those clinical signs are obvious, what's the reality? Is there anything they can actually do? Is there an antidote?
That's the really hard part. The sad truth is, once those clinical signs of Tiamulin-Ionophore toxicity are showing, the prognosis is generally poor, very poor for severely affected animals. And crucially, there is no specific antidote. You can't give something to directly counteract the ionophore or reverse the enzyme inhibition quickly. So treatment really boils down to supportive care. First and foremost, immediately remove any potentially contaminated feed. Stop the exposure. Then it's about providing rest, minimizing stress, ensuring access to plenty of clean water, offering high-quality ionophore-free feed to those that might still eat. Sometimes fluids and electrolytes might help support them. Maybe cautious use of NSAIDs, non-steroidal anti-inflammatories to help with muscle inflammation and pain. But really the focus is on minimizing further damage and just supporting the survivors through it. Realistically, most pigs showing severe signs are just not going to make it. It's more about damage control and preventing more cases.
So if treatment is so limited, it just throws the spotlight straight back onto prevention, doesn't it? Which brings us back to that critical point you made earlier. This is described as a completely preventable management disease, meaning it shouldn't happen if things are done right. It's tied to breakdowns in how things are managed, communication protocols, not some random biological fluke.
Absolutely. That's the core message. And the prevention strategy has to be multi-layered. It involves everyone, right from the feed mill to the farm staff to the vet. First, there's the absolute cardinal rule, the never together rule. Just never administer Tiamulin to pigs that are currently eating or have recently eaten feed containing ionophores, period. And you need active verification, not assumptions.
Okay, never together. What about at the feed mill? That seems like a critical control point.
Huge. Feed mills need a zero-tolerance policy for ionophore contamination in any swine feeds, especially if Tiamulin might ever be used on the farm receiving that feed. This means really strict production sequencing. You make the most sensitive feeds first, maybe nursery pig diets, then other swine feeds, and only then do you run feeds containing ionophores. Thorough flushing and cleaning procedures for all the equipment between runs are absolutely essential. We're talking physical cleanout, followed by running a non-medicated flush material through the system. And that flush material has to be properly labeled and either discarded or used only in feed for non-sensitive species, like cattle maybe. And labeling. Rigorous ingredient and finished feed labeling is key. Prominent labels on bags, on bulk delivery slips clearly stating, contains ionophore name, do not feed to swine being treated with Tiamulin, or similar strong warnings.
Makes sense. What about the vets and nutritionists?
There needs to be formal, closed-loop communication. Before a vet prescribes Tiamulin, or before a nutritionist includes an ionophore in a diet formulation for pigs, they need to communicate directly with each other and with a feed mill manager, confirming what's being fed, what's planned, and this communication needs to be documented, not just a casual chat. And of course, meticulous record keeping is vital. Tracking feed batches, delivery dates, on-farm treatments, you need that paper trail.
And finally, on the farm itself.
On-farm management is the last line of defense. Clear, unique labeling on all feed bins. No confusion about what's in which bin. Making sure bins are run completely empty before a new delivery arrives to avoid mixing old and new feed, especially if the type is changing. And just basic common sense preventing pigs from accidentally getting access to feeds meant for other species, like medicated cattle feed left lying around.
It sounds like a lot of steps, but each one seems critical.
They are, because the consequences of failure are so high.
Yeah, when you think about the economic impact, it's just brutal. High death loss, the cost of trying to treat the sick ones, the lost growth and productivity, even in pigs that survive. It just hammers home why prevention isn't just, a good idea. It's an absolute economic necessity. And an ethical one, too. I can only imagine the frustration, the heartbreak for a farmer watching this unfold, knowing it could likely have been avoided with better checks and communication. So let's just recap the core lesson here, this deep dive into Tiamulin-Ionophore toxicity. It's really a stark, almost tragic illustration of a drug interaction that is completely foreseeable and entirely preventable through systemic vigilance, clear protocols, and just good, clear communication all the way down the line.
Exactly. It's really important for everyone to grasp that this isn't some random, unpredictable adverse drug reaction. It's a direct, predictable chemical consequence of putting two incompatible compounds together in the same animal. That's why calling it a management disease is so accurate. It stems from failures in management systems.
It really makes you think, doesn't it? I mean, if these seemingly minor slip-ups in procedure or just failures in communication can lead to such catastrophic but preventable outcomes in animal health, what other kinds of similar latent risks might be hiding in other complex systems all around us? Think about human healthcare or engineering projects or even just our own daily routines. How could applying this kind of never-together thinking, these robust communication protocols, how could that help prevent other avoidable disasters in contexts way beyond the farm? Definitely something to mull over until our next deep dive.